Hi, my name is Dr. Kappus, and I'm at Niagara Falls Memorial Medical Center. I'm one of the bariatric surgeons here, and I'm here talking a little bit about some questions that many people have about bariatric surgery. So one of the things that a lot of people experience is that um, they see in the news, they see in magazines and on TV, all of these different solutions for weight loss. Every day there's a new diet plan, every day there's a new fitness plan, and there's a huge market around creating these plans. There's a cosmetic component to wanting to be thinner in a lot of cases. But there's also a major health component of it. And whatever your motivations for losing weight, the bottom line is it can be very difficult. And once you get into the category of having excess weight that puts you at increased risk for developing medical problems, that's when we really need to think hard about bariatric surgery or weight loss surgery as a solution. One of the things that patients often find is that they're very motivated to lose weight. They've done Weight Watchers and Atkins, and they've joined a gym, and they have a personal trainer, and they're doing all of the right things. But what happens is, as you gain weight, the way that our body metabolizes fat and actually the signals that our body sends using hormones and neurotransmitters make it harder and harder to lose weight the more we weigh. So for someone who only has maybe 10 pounds to lose, okay, sure, then maybe one of these diet plans or fitness plans is going to work, and that's great. But once you get into the category of needing to lose 100 pounds, for example, you're going to find that losing that weight is a lot more difficult. And that's not because you're not motivated. It's not because you're not doing the right diet. It's not because you're not exercising enough. It's because your body is fighting hard to hold on to those fat cells and holding on to those calories. And it becomes this vicious cycle of obesity where you can actually lose, let's say, 20 pounds just to gain 40 pounds back again. And bariatric surgery or weight loss surgery is one of those methods that we've now been able to show helps break that vicious cycle. I tell my patients that weight loss or bariatric surgery is not, a magic bullet. It's not going to cure all of your problems. It's basically just a huge, huge push in the right direction. What we're trying to do is push you off that cliff into a place where you can start finally losing weight a healthy way, losing weight in a way that's sustainable. And that's really the main benefit of bariatric surgery. As I said, with a diet plan, you need to lose 100 pounds. You might lose 20, gain back 40. With weight loss surgery, the amount of rapid weight loss that you experience immediately after surgery helps you to drop off, let's say, 60 pounds in a matter of 6 months or so. And once you've gotten over that hump, the weight just keeps coming off. And then when you do your diets and you do your exercise and you kind of ramp up those different aspects of your life, you see the results happening and you don't gain that weight back. You keep on seeing the fruits of your labor. Of course, the other huge benefit of bariatric surgery, and that's what we are always most concerned about as physicians, is the reduction of what we call medical comorbidities or problems that come along with having excess weight. So diabetes is a big one. Cancer is a big one. Cardiovascular disease, and that can take the form of high blood pressure, high cholesterol, sleep apnea, heart attacks, and of course things like that are the most concerning. But all of these little pieces basically make it so that your life expectancy also decreases when you have excess weight on you. And that's really another huge motivating factor for us as physicians to try to give patients this option of undergoing surgery to try to kind of reverse that course. So metabolism basically speaks to kind of the hormones, the neurotransmitters, the signals within your body that your different organs and cells are creating to decide what to do with the nutrients and the calories that you take in. So basically, metabolism is kind of the way that your body decides to either store calories, use them up, and that's kind of the gist of it. But it's a very, very complex kind of machine where you've got your brain involved, sending neurotransmitters. You've got your gastrointestinal system involved, sending different hormones. You have your thyroid, basically your pancreas, all these different organs that are kind of all playing a part in deciding where to send calories, what your body needs in terms of energy expenditure. And that's just a very complex kind of machinery that bariatric surgery can actually kind of help, I'm trying to think of the right word, but can actually change that metabolism, kind of put a wrench in the plans of your body so that we can reverse the storage and start working more towards burning. In one aspect, it's restrictive so that it makes you feel fuller faster. And that's kind of the easiest thing to understand about it. But then there's also a portion of it where, for example, if we take out a large portion of your stomach, that portion of your stomach is no longer able to produce hunger hormones. So there's also that component of it. And then there's also, they're doing studies all the time to kind of further understand the pathways involving the pancreas and the liver and those hormonal signals to see how those would also be impacted by weight loss surgery.